Hello and welcome to Wellness Wednesday. I'm James Currie with the Communications Department, and I'm talking to Sade Hobson. She's the Infectious Disease Program Manager, and we're talking about one of those subjects that people don't really like to talk about, and that's syphilis. Sade, what exactly are you going to tell us about syphilis?
So, syphilis is on the rise in Mobile and also in Alabama, along with HIV. So, we want to get women and men in for testing and treatment of syphilis and also testing of HIV as a preventative measure. You can come into our office at 251 North Bayou Street, and you can also make an appointment for testing at 251 690 8889. A
Okay.
little bit
Yeah, I'm sorry. Thank you for telling us that. Go ahead, please.
A little bit about syphilis. Okay, so syphilis is known as the Great Imitator. It's a disease that can look like many other diseases. And we want people to know that syphilis is a highly infectious disease. And the first stage of syphilis, which is marked by a sore, it can appear anywhere on the body. And if you touch someone in a particular area, even if you touch them in their private parts, you can get syphilis that easy. So, syphilis, with the primary stage of syphilis, like I said, is highly infectious. So, you can pass it along very easily, and it appears as a sore. The sore is painless. It can go from your face. We've seen some, like even on your nose, on your mouth, in your private parts. Some people think that syphilis, that maybe they've zipped themselves up or it's a hair bump in their private area when they get syphilis because it looks so common. It is called the Great Imitator. It can look like many other diseases, and some people may not think they have anything. So they usually go to the doctor, and the doctor prescribes them cream or rashes because the first and second stage of syphilis will disappear on its own.
Okay. Um, so let me read from my notes here, and I know you covered some of this stuff.
Okay.
Syphilis is an STD, which is a sexually transmitted disease,
Right.
and it can have very serious complications if it's left untreated. But
Right.
it's very simple to cure with the right treatment. So, um, what is the treatment? You went over some of it, but
Okay, so the treatment for syphilis is a penicillin shot. It's the most effective treatment for syphilis. Syphilis can also be treated with doxycycline. It just depends on what stage you're in for each. So, the first and secondary stage of syphilis, or the first and second stage of syphilis, can be treated with one shot of penicillin, and they can also be treated with doxycycline. The dosage is dependent on what stage you're in as well.
well, we all know about penicillin. It's been around for years and years, and that's safe. So that's a pretty simple treatment. So, can you cure it?
So, syphilis, that's a complicated question, right? So, syphilis can be cured through
Mhm.
the penicillin shot, but you'll always test positive for it. Because it shows up in your blood. It's almost like having chicken pox. Like the doctor will be able to tell if you've had syphilis before, and you can get reinfected with syphilis again, and that will cause your, like, it'll show up in your blood, and the titer. I know that's a big word, but the copies of syphilis will multiply in your blood if you've been reinfected with it.
And you want to tell people what a titer is?
Okay, so a titer is basically the amount of a disease in your blood. So, um, let's say with syphilis, some people who have syphilis, they have a high titer, which means they have a lot of copies in their blood. So when they test the blood, it can go from like 1 to 1, 1 to 2, 1 to 4, 1 to 16, 1 to 32, and that shows how long you have been infected. So with syphilis, the titer will decrease over time, and it can go from like 1 to 32 back down to 1 to 1. That doesn't mean that you're not still infected. You may have been treated, or you just may have had the disease for a long time.
Thank you for that explanation. Saves people from having to go Google that. Um, um, you know, like I mentioned here at the beginning, this is one of those things that we have to deal with at the health department that a lot of people have to deal with, but they maybe not necessarily want to talk about. So, um, if someone thinks that they have syphilis or they have any of these symptoms, like you mentioned, a rash or a sore, a bump, bruise, something like that,
Hmm.
they should definitely go see a healthcare provider or here at the health department and then figure out do they have it, and then they can start treatment, right?
Yes, they should definitely get tested if anyone is sexually active and they have more than one partner, or even if them and their partner don't practice monogamy. They should definitely go get tested at least every 3 months for both syphilis and HIV. We can do those tests here at the health department, but if you go to your private doctor, they do not test for syphilis as a routine disease, so that is something that you have to ask for. Most people believe that syphilis is an old disease, but it's very prevalent right now and it is making a comeback. And for women who are pregnant, we also want you to get tested every trimester. And specifically, if you don't get tested in the first 2 trimesters, specifically in the third trimester between the weeks of 26 to 32. So if you are infected, we can get you treated and make sure that the baby isn't born with congenital syphilis.
That's right. Thank you for mentioning that because it can be transferred from
Y-
mom to baby, and maybe a lot of people don't realize that. So that's an important point. Thank you for bringing that up.
Yes, and with babies born with congenital syphilis, it can cause death in babies. It can also cause other complications, deformities such as like their teeth being like brittle, or being born with jaundice, which is when a baby is has yellow skin. So it can just cause further complications if it's not treated.
A lot of complications, a lot of health problems. So a lot easier for mother and baby from the onset to realize or figure out if you have it or not and how to get it, how to get it treated. Anything
Yes.
else you want to add about your program or syphilis, or you mentioned it was on the rise in this area.
Mm-hmm.
So is it something we're constantly battling?
So yes, so syphilis again, like I said, people think that it's an old disease, but it really is on the rise again, and it's so simple to prevent syphilis. So you can just come in for testing. Again, if you are having sex or with multiple partners or just having sex in general, just make sure that you are talking about it with your partner, and also look for some of the signs and symptoms on yourself and in your partner. So if you catch it, you can catch it at its earliest stage. We do offer testing and treatment here at the health department. Again, that's 251 North Bayou Street, and our phone number is 690-8889.
And that's for the appointment line.
Yes.
Excuse me. So, and of course, testing, the results, and everything else, that's all confidential and covered by HIPAA. So you don't have to worry about, um, anybody seeing you go into a building or a door that says syphilis testing right here.
Right.
So, yeah. So, I mean, yes, we conform to HIPAA and all the privacy laws. So it's a medical test. So, your
Yes.
privacy is secure. Um, well, Sade, thank you for being on Wellness Wednesday and talking about this very sensitive subject.
Yes. Thank you again for having me.
All right. Well, thanks, and
Okay.
join us again for another Wellness Wednesday, appearing on Wednesdays throughout the month. Thank you again.
Thank you.